There are several things we don't know, but all the things we do know are bad. The words of Professor Chris Whitty at the news conference last night. The daily rate of cases is now just under 80,000. Fears about Omicron coming from the UK has led to France making new restrictions for travellers. Only French citizens returning from the UK or British people living in France are going to be allowed in. I got reaction to that breaking news from the Health Minister, Gillian.
Well, actually, my first thought is I'm glad that I cancelled my trip to France because that's where I was supposed to go for Christmas. But of course, every government is dealing with Omicron. Every government has to make their decisions and has their response to it. It is obviously going to alter people's plans, which is very unfortunate. But I think with Omicron around, everybody's got to take the steps that they need to protect their population. Obviously we've chosen to prioritise the booster plan and get everybody boosted who's eligible by the end of the month, which is a very stretching, ambitious target, but that's what we're throwing everything at. But in fact, we've done the opposite now. We've opened up our borders because Omicron is here, and the way we're responding is by getting everybody that wall of vaccine defence back up.
On the booster programme, there has obviously been a huge effort, more than 600,000 jabs in the UK yesterday. I think it's nearly doubling from what it was a week ago. But we've calculated it'll still take to February the 3rd to get 90% of people vaccinated. Are you going to have to increase the numbers of people being vaccinated even more, and is that realistic? Yes,
we will have to increase them even more. We're doing some mass vaccinations at football stadiums as well. We're going to be opening more vaccination centres. We've got, I think it's 20,000 new volunteers who've just come forward, taken up the call to arms. Obviously, we've got the Army helping plan as well. And of course, our wonderful NHS who have been on the front line of this all along. So yes, we know it's ambitious, but we're going to do everything we can to make it it available to everybody who's eligible.
Talking of football stadiums, we heard from Nikki Kanani at the press conference yesterday saying that her advice was for people to go to stadiums to get vaccinated, but not to attend football matches. Is it time for the government to be explicit about that, to tell people not to go to large gatherings like football matches?
Well, we had that debate in Parliament this week, and we passed the new regulations, and the regulations are, to show a negative lateral flow test, or show that you've been double vaccinated. And also obviously to wear masks in those and take the precautions. So we've had that debate, and that's what we think is balanced and proportionate at this time.
It's such a fast moving situation though, and COVID passes are just for 2 jabs, which have very limited effectiveness against Omicron. So is there a case for re-looking at this?
Well, they do have some effectiveness, but you are right, it is reduced. We only looked at it this week, but the lateral flow test, what we're encouraging, we've got many more lateral flow tests. I know there was a little blip in supply, but we've got lots and lots of supply of lateral flow tests so that people can use them before they go to events, before they go to a Christmas party if they've got a plan, or before they go out for dinner with friends. We're encouraging people to use these, test negative, make sure you're negative before you go out and mix too much.
But are there lessons from the past about limiting large gatherings? You know how quickly the virus can spread. Looking back to the first wave, Cheltenham Races was blamed for spreading the infection.
Of course, it's very different from those days when we were at Cheltenham Races. Large numbers of the population are double jabbed. 25 million people, including myself, have had a 3rd dose. Those antibodies are growing all the time. Lots of young people now have been vaccinated. We're urging 12 to 15-year-olds to come forward now and get their 2nd dose. So we're in a very, very different situation than we were.
And to buy time for the NHS as well, we've been hearing from the Royal College of Emergency Medicine, and they're really worried about the fact that large numbers of hospital staff are having to take time off just as the NHS is grappling with winter pressures.
Yes, and that is a worry actually in terms of, not necessarily the amount of people in hospital, but the amount of people who are testing positive, because obviously that could be anybody, which is why we're also urging people to be cautious.
So is it possible that the NHS could be overwhelmed?
No, obviously we have plans in place in terms of staffing levels, and for the NHS to prioritise. I mean, I don't think the NHS would ever say, that's what they think. What happens in these situations is they prioritise, and what we're trying to make sure is that they, can stay fully open and fully operational. There's always these winter pressures. People can go down with flu over winter. This is something that's quite common as well.
And huge challenges in the care sector. You're the care minister. We've been hearing from Mike Padgham, chair of the Independent Care Group, talking about the problems for a long time pre-pandemic, but getting really much more acute over the last few days.
Yes, and again, it's workforce pressures. When you have, the NHS, I think something like 1.3 million people. I think social care in total, about 1.54 million people. Massive workforces with growing demand all the time because of the demographic changes. So we have some short-term pressures. So we've actually there's two funds. One was £162.5 million, which we sent out in November to help with extra staff and pay and retention bonuses. And
because
it's
there
quite
are 100,000 vacancies, aren't there?
Yes, but also this week we've sent out another £300 million to cope with that. Yes, there are, but there's always around about 100,000 vacancies. I did a report 4.5 years ago. I think it was 122,000 vacancies then, and that's because we grow in demand every year. More elderly people, the actual need grows every year. So there is always a number of...
But there are other factors at the moment as well, aren't there? Like the fact because compulsory vaccination, and some would argue that Brexit is having an impact as well.
Well, first of all, thank you to everybody who came forward with compulsory vaccination. It was not an easy decision. It's not something that we took lightly, but we just thought they are dealing with the most vulnerable people who are at their weakest often as well in terms of their immune system, that we really couldn't take a chance with their health.
All of this is likely, though, isn't it, to have an impact on whether people in care homes are going to be able to see family visitors over Christmas?
No, we have put new regulations in place, which has again been unfortunate because we don't want to limit anybody seeing their family, but we try to be again balanced and proportionate.
And just coming on to the economic impact of all of this, you'll have heard businesses saying that what they're facing is a lockdown by stealth. This is the time of year when particularly hospitality theatres make an awful lot of their income, and they're saying they now need more government help. Is that going to be forthcoming?
Well, first of all, businesses are open. We haven't closed them, but there is a lot.
You haven't closed them, but lots of people are cancelling, aren't they? Their nights out.
Yes, of course. One of the things that's true is, if you actually test positive, then you're going to be isolating on Christmas Day from now on. I think that is impacting some people's plans, of course. But we do still have in place quite a lot of support for business. So we still have reduced VAT at 12.5%. That's up till March. We still have business rates reduction, 66% reduction up until March, and we have business loans, recovery loans in place as well.
Business say that isn't going to be enough, though.
Well, of course, the Chancellor keeps everything under review.
Gillian Keegan, thank you for talking to us.
Thank you.
Brings us